Hello, my name is Deborah Jean-Baptiste, and I'm the director of the Adult-Gerontology Primary Care Nurse Practitioner program at Regis College. It's nice to be here to speak with you today. A little bit about me. I have been an adult gerontology nurse practitioner, primary care nurse practitioner for a little over 6 years. I earned a bachelor's degree in cell molecular biology with minors in chemistry and psychology, then earned a master's degree in an accelerated nurse practitioner program. Prior to starting at Regis, I have taught for many years in nursing. I started at Regis as an adjunct faculty in 2009 and then transitioned into this role in 2020. I started my career as a primary care nurse practitioner in the primary care setting and worked there for about 2.5 years. Then I worked in an occupational medicine setting for about 4 years. I currently work in a geriatric and occupational health setting now, as well as my academic role here at Regis. Here with me is Shawn, who is a current student in the Adult-Gerontology Primary Care Nurse Practitioner program. He's currently in 664E and 664EX, which is the first of the track-specific clinical courses, Primary Care of the Adult Geriatric Client, Part 1. Shawn is going to be speaking a bit about his experiences in the Adult Gerontology Primary Care Nurse Practitioner program, and will be sharing some firsthand details of online student life at Regis, plus some advice to help you excel in the program. Thanks for joining us today, Shawn.
Thank you for having me. It's great to be here. It's great to be a part of this initiative on educating future nurse practitioners. What I've mostly enjoyed about the program so far in general is the collaboration amongst students, amongst the faculty, and how they have supported myself and all students in this journey. Because I'm embarking on another journey where I'm independently will be practicing and making those independent decisions.
Shawn, maybe you can share a little about your journey towards becoming an adult gerontology primary care nurse practitioner and the reasons why you decided to advance your nursing career by preparing to become an NP.
I guess I can start with my education. I've been a registered nurse for 22 years. I have a bachelor's of science in nursing. I have a master's degree in nursing and a master's health administration. I have a doctorate degree in health administration as well. My primary experiences have been emergency nursing and intensive care unit. My current interests, I guess I would say my interest moving forward, of course, is primary care and maybe some specialties working with communities in rural communities, doing a lot of teaching with men specifically, and how I would like to take a stance in being that advocate and talking to communities on how important health is. I advanced my career to become a nurse practitioner only because I see the aging population of my family, and I think it's very important for me to prepare myself and for me to be that advocate for communities that just really do not know the ins and outs of healthcare. And I don't think I know that Regis College can do this because, what drew me is because, they represent this, what can I say? When I was reading up and doing my research on it, it was the Catholic traditions and the social justice that they represent on how they want students to reach out to their communities to give back.
I can agree with many of your points, Shawn. I decided to pursue a career as an adult gerontology primary care nurse practitioner because I wanted to have autonomy in caring for my patients, the ability to make appropriate clinical decisions like performing exams, diagnosing, ordering and interpreting diagnostics, writing prescriptions, making referrals, and directing their care appropriately. And as you said, I wanted to promote primary prevention and keep people healthy in their communities. I started my career in primary care serving underserved patients. Many of the patients had not received appropriate health care for many years and were very ill. This created a steep learning curve, but prepared me to meet the challenges I was faced with and allowed me to learn and grow as a nurse practitioner. There are many reasons for students to advance their career by becoming a nurse practitioner. Becoming a nurse practitioner gives you more autonomy in caring for your patients. You have many options to choose from as far as where you want to work, your hours, and the ability to specialize if that's what you're interested in. You also have the ability to pursue more education with a doctorate such as a DNP or a PhD degree, which allows you to conduct research, teach, and direct change in your discipline. I wanted to talk about what specifically an adult gerontology primary care nurse practitioner is. These NPs care for patients who are age 13 and above. This includes adolescent patients, adult and geriatric patients. It is important to understand these populations come with their own challenges. Therefore, this certification provides the knowledge you need to care for these populations specifically. The adult gerontology primary care nurse practitioner track differs from the adult gerontology acute care nurse practitioner track, although the names are a little bit similar, in that it cares for patients with chronic diseases as well as some acute conditions. It provides for a long-term relationship with the patients and focuses on disease management, disease prevention, and health promotion. I wanted to talk a little bit about the curriculum at Regis. Shawn, can you first tell us what skills and knowledge you were hoping to gain out of the program before you joined and what you've gained so far?
I was looking to really gain, I think you talked about the autonomy, and I think it's very important for me to gain that skill and being comfortable and being able to practice independently and make those clinical decisions. I was really, I'm gaining that exposure and I'm gaining that skill, but that's specifically what I was looking for, and I'm continuing to learn and to grow on that. The courses that I've taken from pharmacology to advanced health assessment to pathophysiology, I have definitely learned and build upon those earlier courses for me to get to this stage of practicing independently. The clinical seminar courses, they're very, very helpful in order for me to become independent because of the different Q&A sessions that you have within your clinical seminar courses, along with tying into when you go in the field and work into clinical. I've placed myself in a position where now I'm able to learn from what I've been taught, and now I can apply it to my current workplace and my current work setting, where now I'm involved with, I may not be in clinical or in school in my current work setting, but now I'm able to work along with talk to other NPs, and they do Q&A about different disease processes and things with me because they know I'm in school. So all of this ties into an end result for my success.
In addition to track-specific courses, this program offers classes in research, nursing theory, leadership, health policy, as well as the science and clinical courses that Shawn had mentioned. Also classes in health assessment, pathophysiology, and pharmacology. This produces well-rounded students who are able to meet the challenges they face after graduation. In the track-specific courses, you are required to complete 600 clinical hours in order to graduate. Students precept in primary care settings, women's health settings, and specialty settings. They complete the clinical hour requirement in 2 to 4 semesters, and again, this is once the student reaches the specific track courses that they take towards the end of the program. So tell me, Shawn, are there any aspects that you find challenging about the Adult Gerontology Primary Care Nurse Practitioner program so far?
One thing that sticks out to me specifically is me, not specifically in the courses itself, because with coursework, it will take some time for any student to learn the material, grasp it, study it, and apply it. My challenge was the time management piece, the work-life balance. And what I've done was I just took my schedule and allow myself 2 days of rest, and the other days allow myself 4 or 5 hours, putting that effort into my studies, and then I map out what days I'm going to do clinical. And again, what we just talked about earlier, notice the common theme is you, the student, you are in control of this. And that's what is the beauty about Regis colleges. It's so independent, and it kind of teaches you to be very autonomous, and carrying it on further when you go into your clinical. So, I try to put in at least 20 to 24 hours a week of school and clinical, school time, work studies, so I can be successful.
This program has a robust and challenging curriculum with the 600-hour requirement, so you're well prepared and confident to sit for board certification. Certification requires 500 hours, and other schools can require 700 plus hours. So Regis is right in the middle with our 600-hour requirement. There are 2 organizations that offer certification as an adult gerontology primary care nurse practitioner. There is the ANCC, the American Nurses Credentialing Center, and then the AANP, which is the American Association of Nurse Practitioners. You can choose one of these organizations for your certification. Students are prepared to sit for their boards through the curriculum, specifically clinical hours and material gained in the clinical and track specific courses they take at Regis. Regis offers practice tests as well as readiness exams that will help guide the student in areas they may need to focus on, and this is built right into the courses.
The what I want to talk about is looking at how my instructor, I guess I should say my current instructor, Professor Jean-Baptiste, is doing for our educational journey, caring for her students. She also offers office hours, Zoom calls, live sessions, email, texting. I text her on a few occasions, and she provided some feedback to me. So to get that intimacy is just absolutely awesome.
Thank you, Shawn. It's great to hear that you feel supported by the faculty, because that's certainly something that we strive to make sure that all of our students feel supported throughout their journey. Can you tell me a little bit about your plans after graduation, your career plans? Maybe you can tell us about some of the workplace settings that you've considered, and what other future adult gerontology primary care nurse practitioners can expect to find themselves in.
Sure. Specialty care clinics where they're treating sexually transmitted infections, diabetic clinics, like endocrinology clinics, I think is great for students to know that you do have options, because this is what Regis College is preparing you for. When I finish college, my typical, what I'm thinking of myself is doing is really practicing, or maybe practicing having a telemedicine, because I like, as I said earlier, I really want to reach out to, especially my community, where, it's less than 10,000 people. You have to drive 2 hours to the nearest, or hour and a half to the nearest primary care center. They don't have a lot of advanced nurse practitioners. They have probably they just don't have a lot of that healthcare resource, and I want to be the resource. That's why I'm really focused on this nurse practitioner program, to learn as much as I can, because I want to be that voice for them. It is definitely a passion of mine, because that's my hometown. I grew up there, and I want to be able to do that, even if it's providing telemedicine services, which is, as we've seen in the recent pandemic, many primary care providers, and then we're talking about nurse practitioners as well. I have a nurse practitioner who is a primary care provider, and who is my primary care provider. So definitely the sky's the limit there, and I'm excited for the opportunity.
The great thing about adult gerontology primary care nurse practitioners is that there are many options in career choice and great earning potential. Adult gerontology primary care nurse practitioners can work in urgent care settings, outpatient specialty practices, and of course in primary care settings, just to name a few, like Shawn had mentioned as well. Many states are moving toward independent practice for nurse practitioners, meaning they will require no physician oversight. In many states, nurse practitioners can already practice independently, and new states are being added. Specifically, Massachusetts, where Regis is located, just became an independent practice state for NPs, which is very exciting. NPs have been working hard for years to gain independent practice in the state, and this really illustrates the importance of NPs and the recognition of our skills and our knowledge. And this also helps remove some barriers to care. So before we wrap up, Shawn, why would other aspiring adult gerontology primary care nurse practitioners join the online program at Regis?
I have to go back to, again, what I said earlier, and what the mission for Regis College, and looking at their values as a university, as a college. And, being that Catholic intellectual traditions, welcoming and wanting their students to be involved in their communities. They provide, and as a witness to this, they have provided me with rigorous types of education to help me, to assist me in being innovative and learning. For example, my professor, Deborah Jean-Baptiste, has us develop specific guides to help us learn the different diseases and how we maneuver through them. I think incorporating all of those things into the curriculum really shows that they are supporting their mission, and what they represent. They represent all those things. And specifically, notice I said Catholic. They want students to care for all God's creations. And I think that is what, in a nutshell, the biggest thing that I can say about it. Caring, being peaceful, love, hospitality. You see how all those core values really fit. And I looked at those core values, and that's what I'm about. I'm about every single one of those types of values that Regis College represents. Each of the faculty members, from my experience since day one, has been very intimate with myself, and with the group sessions that I've had with faculty members. They have been very collaborative, and I think that's very important. It's so it's so wonderful to hear how an instructor will take the time to hold these sessions with you and allow you, and even, when we go over our time frame, let's say you have a 60-minute time frame. Sometimes on our clinical sessions, our discussions get so interesting. We're discussing different cases. Not once does Deborah Jean-Baptiste say, "Oh, it's time to go." No, she continues on as long as the conversation, we are talking about our clinical cases, she is on it. So, it's great, and all the students are engaged because why? And why are the students engaged? Why are the students engaged? The students are engaged because of her energy, and what she gives when we're receiving that. Because that's what that is, and that is the truth. The energy that she gives the students, we receive that. I think it's very flexible how Regis College has us to do our coursework online. We can do it the day, night. That that is great in itself. We have very small classes, and I think that we as students and me as a student find it very helpful and find it very, I wouldn't say easy, but it does assist us in our journey become adult primary care nurse practitioners for the future. I just want to congratulate and thank Professor Deborah Jean-Baptiste on all her hard work and dedication from advanced health assessment and from this course, because I know I learned from her, and I can say that, and I can tell Regis College, and I can tell students I've learned from her, and she gave me what I wanted.
Thank you, Shawn. It's really great to hear that. And this program is rather small, so it really is easy to make those connections with the students. Certainly, students connect with one another, but the program being so small, I think it's easier for students to kind of lean on each other and say, hey, what's going on over here? What do you think about this? And then it's easier as a faculty member to also reach out to students and answer their questions quickly and thoroughly and look into things for them when needed. So again, I'm really glad that you're feeling the support from the faculty. And I wanted to thank you for sharing your experiences and wish you good luck in the program. Thank you to prospective students for watching. I encourage any student who is interested in the Adult Gerontology Primary Care Nurse Practitioner program to reach out to one of the advisors at Regis for more information. And of course, I am always available to answer questions about this great program. Thank you.